Hey, what's up you guys? I'm Dr. Sharma. You may have noticed that sometimes you wake up out of bed with a weird pin and needle sensation in your hand, or sometimes it may feel numb and cold. What causes that, and is there some way that you can prevent it? That sensation that you may be feeling is most likely some temporary neuropathy or decreased blood flow to your hand. Now I'm going to explain exactly what that is in a second. When we go to sleep, we actually sometimes have a very awkward position. A very common position is the fetal position. The fetal position is a pretty common sleeping position, but if you'll notice sometimes when you're in that position, your wrist may be in a prolonged flex position, either against a pillow or the bed. This causes a tunnel inside of our wrist known as the carpal tunnel, which is formed by the flexor retinaculum on the palmar side of our wrist, to narrow. The carpal tunnel contains not only flexor tendons, but also the median nerve. The median nerve is important for innervation and motor functioning of the fingers. Most importantly, fingers 1 through 4. Any stress that may be caused on the median nerve will cause the palmar side of those parts of the fingers to become numb, have a pin and needle sort of prickly sensation, which may be the sensation that you may be feeling that's waking you up out of bed. Now, normally this wouldn't really cause an issue in otherwise young and healthy wrists, but there may be some predispositions that you may have to carpal tunnel syndrome. So what predisposes you to carpal tunnel syndrome, and how do you know if you actually have it? Well, prolonged repetitive stress motions on the wrists, such as pianists who play the piano, or keyboard typing, which a lot of people do for their work, a guitarist, which is actually the issue that I have, a butcher who may be cutting meat or doing repetitive motion, and actually obesity is an independent risk factor. These would increase your risk for carpal tunnel syndrome, meaning that the carpal tunnel itself is already narrowed, and therefore any repetitive stress motion or prolonged flexion of the wrist will cause that issue and cause stress to the median nerve, resulting in numbness or that tingling sensation that you sometimes feel. Another cause is actually decreased blood flow. Decreased blood flow to the fingers may also cause a numb or cold sensation, which may be caused by pressure on the hand, such as the hand being left under the pillow underneath your head for a prolonged period of time. You'll notice that you'll feel these symptoms pretty temporarily, and that when you wake up, after shaking your hand for some time, after a couple minutes, it should go away. Now, is there any way to actually prevent this from happening? Well, unfortunately, it's not really easy to control your movements at night or control where your hands are going to be, especially if they're going to be in a fixed flex position. But if it really causes you issues, I've seen people use a small towel, place it on their wrist, and use a ACE wrap to keep their wrist from flexing when they go to bed. Or those people who actually have carpal tunnel syndrome may actually have splints because they've been diagnosed and actually have that issue during the day. So are there other causes besides the two causes that I just listed? Yeah, there are other less common causes, such as cervical radiculopathy, which is disc herniation or degenerative changes to the cervical spine resulting in compression of nerves and nerve roots. Diabetes, resulting in peripheral neuropathy, which is caused by long-term levels of high glucose resulting in damage of nerves, causing that pin and needle sensation. Alcohol abuse, which also directly affects nerves. Chemotherapy, amongst other causes. And if you feel like any of those are the causes of your symptoms, and you may be having these symptoms during the day, be sure to ask your healthcare provider to have this elucidated. I'm going to be posting another video on how you would be able to tell if you have carpal tunnel syndrome and some of the physical examination signs that we do in the clinic. Like and subscribe for more videos, leave any comments or questions below, and good luck.